Today we are offering our first lecture of the Fall to Spring series at the Dittrich, and these are called Conversations. And conversations are meant to be just that. So it starts off with 15 minutes of me giving you something kind of like a TED Talk, and then we have a panel of people that discuss things for another few minutes, some questions, and we kind of get the ball rolling, and then it's your turn. We have some small group discussion, and we open it up to a large group, and we all take part in a conversation about the kinds of things that, that interest us in medicine. And here at the Dittrich, which is upstairs, we are really fascinated by the way the community and medicine work together in history. Cleveland has been a medical center for a very, very long time, and the public has always been really a part of that. And this year, we're spending a lot of our time focusing on public health. And that's partly what we're going to be talking about tonight. But in an election season like this one, presidential candidates and health seems to come up a lot. So we're going to be doing a little bit of that tonight as well, describing the way what happened to President Garfield changed medicine's practice over time, and how that affected the public and the public anticipation of what it meant to be healthy, what antiseptic medicine was about, germ theory, and other things like that. So I'm really excited that you're here. And I also wanted to start off by thanking our sponsors. This year, we've been sponsored by the Department of Bioethics at Case Western Reserve and its Medicine, Society, and Culture program, which is like a medical humanities program. And they've helped us, as well as the Cleveland Medical Library Association, who has continued in support of these programs. Also, welcome to the Allen Memorial Medical Library. If you've never been here, it's a beautiful space. This is the Powell Room, and it's one of my favorite spaces to hang out. Students work in here all the time. Oh, I should tell you who I am. I'm Brandy Schillace. I'm the public health person. I do public health and engagement, public engagement for the museum. So, President's Public Health and Pre-Antiseptic Medicine. This is basically about President Garfield's death and its effect on antiseptic rhetoric in the public. And if you don't know a lot about President James A. Garfield, he's buried, actually, at the cemetery here in Cleveland. He was from Ohio. He actually grew up not very far from Mentor, and his estate is still there, if you have ever toured his house there. But he was really a fascinating individual. I think we like stories about people who sort of raise themselves up by the bootstraps, kind of rags to riches stories. We always like those kinds of stories. And he started off very, very poor. He was raised on an Ohio farm. His father died when he was very young, and his mother then had to run the farm with her children. They were always kind of on the near edge of poverty. He also ended up serving in the Union Army during the Civil War, and he rose to he was greatly esteemed by his men. He was very warm and very interested in their health and their safety. But more specifically, as he traveled into the South and saw the ravages of slavery for the first time, he was incredibly moved by this. And he made it part of his platform that people should be equal, that they should have equal rights. And he was very interested in promoting that. He was voted to the Ohio Senate in 1859. He served 9 terms in the House of Representatives. And ultimately, he ends up being president of the United States in a somewhat chaotic fashion. And again, this is one of those stories that I watched a wonderful documentary not too long ago. It was based on the book by Candace Millard. And he wasn't one of the candidates to begin with. He was supposed to be giving a nominating speech for someone else. And after he gives this wonderful speech, he says, "What do we want?" And the crowd shouted, "We want Garfield." And that would have been a surprise. He ends up being nominated, and then in a surprise vote, he actually turns out to win the presidency. And he promoted civil rights and agricultural needs, and also reforms. And when I say reforms, what I'm talking about is machine politics. And that means a lot of different things. But one of the things it meant in the 1870s and 1880s in this country was a lot of corruption. That meant that people could sort of, they did favors and they got paid. I mean, it's completely unlike politics now. They did favors and they wanted positions in the government after that occurred. And some of this meant, what it really came down to was who had the money to promote their interests. And there's a gentleman by the name of Roscoe Conklin. And I like that because it sounds like some sort of reboot of the Dukes of Hazzard. He was essentially a figure who was very corrupt. He had a lot of power, and he used it unwisely. He had control of the customs. Partly, things were based on where the money came in, and it came in at the port. So the Conklinites were also called stalwarts, and what that really came down to was if you did anything for the candidate, then you thought you were owed a job once he got elected, and you could show up and sort of demand your position in payment for your favor. So this gentleman here, you see he's holding a piece of paper. It says, "An office or your life," and he has a gun in one hand. That's Charles Guiteau. He actually bought an ivory-handled British bulldog revolver for what he was about to accomplish because he thought it would look great in a museum. Yeah. He was on a mission inspired by God, he felt, to kill the president. So trouble's brewing. Guiteau supported Garfield and considered himself a stalwart. Actually, when he was arrested, he said, "I'm the stalwart of the stalwarts." And he had written a speech, and he'd managed to get it printed up, and he was passing it around everywhere. And he never actually gave the speech. He got up to give the speech, but he got nervous, and he wasn't able to get through it. But he felt that he deserved something. It was a way to sort of flatter people. He introduced himself to the various political people involved. He went to the caucuses, and he thought that he deserved a post as the Paris consul. He didn't actually speak French, which would have helped, but he felt that he deserved this job, and he kept coming to the White House and saying, "Look, I did this, I wrote this speech, I deserve to have this job." And people were kind of like, okay, no one really took him that seriously. And finally, he was told flat out, "You're never getting this job." And it was at that point that he decides that assassination is the best way to end the deadlock between the stalwarts and what were the stalwarts called those who wanted reform half-breeds. And those who wanted reform wanted to change the way civil service was done. In the trial, by the way, of Guiteau is one of the earliest times that not guilty by reason of insanity was used. There was a lot of things maybe not going well for Charles Guiteau. He had not made a very big splash in life, though he'd tried and failed at a lot of things. He skipped out on a lot of rent checks. And he tried to be a preacher, he tried to join a commune, and then he decided to make his mark in politics. And he thought he was doing the world a favor. It wasn't that he didn't like Garfield, which is interesting. He thought he was okay. But he felt that he was going to heal the nation and bring the stalwarts back to power by killing Garfield. And he really felt elated after this event occurred, which is kind of sad. So, President Garfield gets shot. President Garfield's wife had just been ill, and she was at the seaside. He was going to meet her. And the interesting thing is the papers carried very detailed notes about where he was going to be and when, because nobody thought that it was dangerous. Nobody thought that presidents were at risk. We elected them. If we don't like them, we'll just unelect them. We'll just get rid of them. We won't elect them again. Surely no one would try to kill a president. But that had just happened to President Lincoln. So it's interesting the way nobody really thought that this was dangerous. And in 1881, it's in July, only 4 months into his presidency, he's shot by Guiteau. And he's shot twice. Guiteau then tries to get away, is captured, and starts shouting that he's in favor of Arthur. This is the vice president, who is also a Conklinite. And so this also makes trouble for the vice president, who's suddenly the enemy of state in some ways. One bullet probably lodged near his spine. As soon as Garfield was shot, the doctors who surrounded him immediately tried to find the bullet. They're right on the floor of the train station. They're probing, they're trying to dig it out. Most doctors thought that if you didn't get the bullet out, the wound wouldn't heal. Now, that's not always the case, but they did think that at the time. Willard Bliss and other doctors, as many as 16 possibly, probed the wound and tried to help the president. I should mention that Dr. Willard Bliss was a somewhat problematic figure. This is the 1880s. Now, in the 1870s, 1880s, here in Cleveland, antiseptic medicine was already starting to get a little bit of acceptance. Gustav Weber was very interested in it and in using antiseptic. In 1881 and 1882, you have Dudley Peter Allen coming back to Cleveland after travels abroad and really promoting antiseptic medicine. But not everybody bought this idea of germs. And you can kind of understand why. Say small invisible things are making you sick. a lot of people, that just sounded like nonsense. Well, Willard Bliss had no respect for Joseph Lister or antiseptic medicine. That's going to play a big factor in Garfield's death. So, Frank and Leslie's illustrated newspaper, there is Garfield having been shot, and then pictures of Garfield at his bedside with his wife and his daughter, and he's ailing. Images of the huge public outcry. People were incredibly worried about the president, and they brought flowers, and they were, constantly calling. Someone actually shot a couple of wild game birds and brought them to the White House. They thought maybe it would help. The doctor in this case, Willard Bliss, he ascribed to an old way of doing medicine. And this pre-antiseptic medicine had a lot of funny ideas. One of them being that dirt wasn't necessarily bad, cleaning a wound was bad, that pus was good. It was a good sign that your body was doing, it was laudable pus, they called it. Isolation, they thought isolation was a way of treating a patient. Laudanum or opium was given to the patient. So you can see these screens in this image here. They wouldn't let anyone come and see him. But that also meant Dr. Bliss wouldn't let any other doctors see him either. And he became very, very protective of his patient and didn't want anyone else to take part in taking care of him. I put this picture up here because Facebook, Twitter generation, we had a version of this. This was such national news, and news was spreading quicker than you might imagine. But of course, you couldn't print papers instantaneously, so they put big bulletin boards outside of news offices, and they would run outside and they would update it periodically. And it's almost like a big Facebook board, and everybody's taking part in trying to learn the state of the president. And for a while, people thought that the president might get better. If you have a chance to step upstairs into the museum, you will see that we have a Crosby invalid bed. Now, the Crosby invalid bed is the type of bed that Garfield ended up using when they brought him back to the White House and later when he was at his cottage. You'll see this as it's a testimonial by a Dr. Boynton. He's going to come back into the story too. He says a large number of these invalid beds were sent to the White House for the president's use among Crosby's, and that this was the one that they felt was really the best one. Boynton was a Cleveland doctor, a Cleveland homeopathic doctor. He was also a relation. He was a cousin. And he had come from home to DC to check in, to be part of what was happening to the president. And it turns out later he's one of Willard Bliss's biggest critics. Ignorance is bliss. So Dr. Bliss, he really didn't understand what he was doing. He thought he was working for the best. But in addition to being incredibly protective and not allowing other doctors to see him, when Boynton suggested that they clean the wound, he basically told Boynton that if he that he should keep his opinions to himself. He also thought that one way to administer nourishment to a patient who was having trouble keeping things down was to put that food up the other direction. It doesn't work. It doesn't work. Vegetable soup suppository is never a good idea. The president ends up losing over 100 pounds before he dies. The other thing that's really problematic here is because he continued not to treat the wound in terms of cleanliness, but he also continued to probe the wound over and over again, digging for this bullet in President Garfield's back. Slowly, a large gaping sort of channel starts to form where infection is disturbing the tissue, and Dr. Bliss thinks that this is the path of the bullet. So he keeps digging in there, and he basically opens up an avenue for infection. Once a body gets infected to the point where the immune system can no longer fight it off, you become septic. The blood poisoning or blood sepsis ultimately means that infection can show up anywhere else in your body. He started having abscesses in his face, on his legs and arms, where just infection was coming out everywhere. And even at this point, Willard Bliss knew something was terribly wrong. He was willing to try other methods, but not antiseptic methods. He brings in Alexander Bell, the inventor of the telephone, actually gets an apartment nearby and develops a metal detector to try and find the bullet. Now, there's a couple different stories about this matter, and one is that he actually was thrown off by the metal mattress. But another story is that Willard Bliss basically wouldn't let him examine very thoroughly. Bliss was pretty sure the bullet was on one side. That was the side he asked them to examine, and they didn't find the bullet there. And essentially, the test is both a success and a failure. It's not able to find the bullet. When the president dies, and die he does, he goes to the seaside. He demands to go to the seaside. Willard Bliss says, oh, it's too dangerous to move you. And the president says, I'm not asking your permission. They take him to the seaside where he can feel the ocean breezes. It's now September. And he knows at this point that he's dying. To let you know just how well beloved he was, they took him by train, and crowds showed up, and they threw straw on the rails to try and soften the passage on the way to the cottage by the sea. There weren't enough rails. There weren't enough track. Volunteers showed up and built train tracks to the door of his cottage. And there he ultimately perishes. In the autopsy, they find out that, in fact, the bullet was not where Willard Bliss thought it was, and that the cause of death was also not necessarily the bullet. He died of horrible, horrible infection. A channel extended from the external wound between the loin muscles and the kidney almost to the right groin. So this is the path of infection, just decimates the inside of his body. And about that time, criticism hits the papers. Well, criticism has been kind of going on anyway, but Bliss has kept anybody else from seeing the doctor. Boynton goes to the press and starts saying, like, he should have cleaned the wound, he's not treating him correctly. And doctors from abroad were appalled, particularly from Germany. And they wrote on newspapers and other things that he has done harm. He has violated the idea that doctors should do no harm, and he's responsible, his treatment is responsible for what killed him. I should also say, by the way, that Guiteau used this in his trial and basically said that he shouldn't be indicted, they should indict the doctors. And on one hand, no one's going to believe Guiteau. On the other hand, that stuck in the papers and that stuck in people's minds. Before antiseptic, the types of instruments that were used were like these. We have these upstairs. There's actually some in here in this room as well. You'll notice a few things. There's felt cases. There's ivory handles. There's wood handles. There's all kinds of material that could hide germs, that couldn't be sterilized, it couldn't be cleaned. When you get to antiseptic and aseptic medicine, you start to see very different kinds of instruments. Things are made of steel, things are sterilized. And that is the carbolic acid sprayer. We have one upstairs. That's developed by Joseph Lister for use in surgery to spray on the wound site to kill the germs that are already there. Because you're bringing germs with you. There's going to be germs. And in fact, in the period between 1886 and 1893, there was a lot of overlap. You had people kind of still using wooden-handed instruments, but washing up and washing wounds. And there was a lot of misunderstanding about exactly how the method ought to be put forward. And Dudley Peter Allen gets a lot of credit for actually getting us back on track with antiseptic medicine right here in Cleveland. And in fact, he brings that carbolic acid sprayer to Cleveland with him. I think this is an important story because if it had been anyone else, probably it wouldn't have hit the papers this way. But it was all over the newspapers all over the country. It was very, very detailed. There were visuals, and people felt deeply wounded. They felt as though they had suffered a great, great loss. There was public mourning on a massive scale. His funeral here in Cleveland was bigger than Lincoln's funeral. It was enormous. And that meant that his death and his manner of death and the autopsy for his death and the criticisms about his death were all also in the public eye. They were in the newspapers. For the first time, maybe, some people who were just average, everyday people were reading about antiseptic medicine. We're reading about germ theory. We're reading about treatment. That can change things. So it was a horrible waste of life. Many people felt that they'd been robbed of the future that he had promised. But at the same time, this public outcry brings germ theory into the public and in many ways probably influenced its acceptance. If nothing else, it provides a case study for people to point to for the value of cleaning wounds and and sterilizing instruments. In some ways then, the most important change that develops in medicine, and some people today still say it's the most important change that's ever happened to medicine, is the acceptance of germ theory, the use of antiseptic. The fact that you no longer had to have your foot amputated if it got infected. The fact that a bullet that might have paralyzed him, possibly, but wouldn't have killed him if antiseptic had been used. These two paintings are, the left is Samuel Gross, who is opposed to Lister's antiseptic surgery. Gross is the portrait there is 1875, and he's clothed in blood and pus and a stained frock coat, and onlookers are sort of cowering. And on the right, you have David Hayes Agnew, who embraced antiseptic medicine, and you kind of see the Agnew Clinic, and it's sterile and it's clean, and there's, you know, gowns and things. And so I think that we can, in many ways, thank President Garfield for his sacrifice in helping us to accept germ theory and antiseptic medicine and bringing that idea to the public in ways that had never been before. By the way, if you haven't been upstairs, I thought I'd just give you some teaser pictures. We're closed right now, but you should come back. We're open Monday through Friday till 4:30, and Wednesdays till 7, and Saturdays 10 to 2. I would like to bring up our panelists now to talk a little bit about public health and presidents and politicians and health of today. Come on up, guys. What I'd like to do is actually have you guys introduce yourselves a little bit, and hopefully everybody can see you. I don't want to get in the way here. We're going to have a short panel discussion, and then we're going to ask all of you your thoughts on these same matters.
Well, good evening. My name is Eric Rivette, and I am the Curator of Collections and Exhibits at the Western Reserve Historical Society.
Hi, I'm Scott Frank. I'm a family doctor and a public health practitioner, educator, and researcher. I am the director of the Master Public Health Program here at Case Western Reserve and the director of the Shaker Heights Health Department.
All right, great. I'm going to start off talking to you, Eric. I know that you guys have just done a really interesting exhibit over there on politics and power. What are some of the things you can tell us about presidents from Ohio? Because, of course, Garfield is from Ohio, and he's not the only one.
Right. Well, let me start off by saying I am not from Ohio. I'm from Louisiana, so forgive me here. Ohio claims 8 presidents. You don't get 8 presidents. You have a definite 7, maybe a hard 6. So the earliest one, of course, is William Henry Harrison, who is not from Ohio. So there you go. When William Henry Harrison was born, there was no Ohio. He was born in Virginia and lived most of his adult life in Ohio, but again, not from here, so sorry. Of course, William Henry Harrison, since we're talking about public health, is most famous because he is our shortest serving president. William Henry Harrison, of course, was elected and is most well known because he gave a 2-hour-long inaugural address. Still to this day, it's the longest address given by any president. And as the story goes, it was cold, it was raining, he didn't wear an overcoat, and he caught pneumonia and died 30 days after taking office. So that's William Henry Harrison. The other presidents, of course, Ulysses S. Grant, James Garfield, Benjamin Harrison, who was William Henry Harrison's grandson. He is the other one I would say, if you could go back in time and ask Benjamin Harrison, he would say he was from Indiana. He was the governor of Indiana. He lived almost his entire life in Indiana. He died in Indiana. He's buried in Indiana. But he was born in Ohio, so I'll give you that one. Of course, William McKinley, who was also assassinated, William Howard Taft, Warren Harding. So again, 8 presidents. Ohio is known as the mother of presidents. Depending on how you score it, Ohio is either in the lead for the production of United States presidents or tied.
All right. Yeah. It also seems like an awful lot of Ohio presidents died in some somewhat unfortunate way, either by being assassinated or catching pneumonia.
In fact, we have a presentation that we give at the History Center that's called The Curious Fate of the Ohio 8. Of Ohio's 8 presidents, of course, 2 were assassinated and 2 died in office. And of the other 4, again, this is a hard thing to say, but if you look at the track record of Ohio presidents, it's not necessarily great. They either were assassinated, they died in office, or their presidencies were mediocre at best.
I want to ask you, Scott, about how do politics and public health go together today?
Well, we clearly have many examples. A presidential candidate who has not yet died of pneumonia. And the health records of the presidential candidates this year taking on disproportionate value, with one candidate being proclaimed by what appears to be a retired hippie as the, if elected, would be the most exceptionally, oh, sorry, thanks, Paul. The most exceptionally healthy president in history. I'm sure he's done a study of the health of presidents throughout history and came to that conclusion in a very rational fashion. So, you know, health has a role, but, you know, from my perspective, it really moves beyond presidents and health, but the impact of these presidents on popular culture, on current events, on history. And, you know, I can trace a direct line from the 1700s and Anthony Leeuwenhoek with his microscope, the inventor of the microscope, father of microbiology, identifying tiny animals, to Pasteur in the 1860s, proposing germ theory, to Lister in the late 1860s, pioneering antiseptic practice to today. Two of the adherents of Lister were Joseph Lawrence and somebody by the name of Robert Wood Johnson. Joseph Lawrence invented a liquid substance for antisepsis, and he wanted to name it after Lister because of his contributions, and that is what we know as Listerine. The mouthwash was originally an antiseptic that was used to clean wounds, while Robert Wood Johnson, as an adherent of Lister, went on to create Johnson & Johnson, made the first medicinal plasters, which became our Band-Aids of today. And in 1920 or so, today's Band-Aid was invented in the Johnson & Johnson company, founded by Robert Wood Johnson, starting from medicinally impregnated plasters that were used as the first surgical dressings. So all of Garfield's drama, you'll notice in the UK, where Lister practiced, 1867, and it wasn't until the 1990s or 1890s that antisepsis became accepted in the US, sometime after Garfield's death contributing to that acceptance, and it was around that time that Lawrence and Johnson were making real some of the contributions that Lister had started in the 1860s.
It's an interesting point, I think, for all of us to consider, that you can't actually push medicine or medical discoveries on a public that's unwilling to receive them. And so it wasn't just Dr. Bliss. There were a lot of people who were not interested in antiseptic medicine, and it took actually a tipping point. It took the public enjoying and understanding the benefits of what this offered. Do you see similar things with the other presidents that you've studied for the event or the exhibit that you guys have over there?
Well, what's interesting to me is that, to get back to William Henry Harrison, I had mentioned, the things everybody knows about William Henry Harrison, of course, Tippecanoe and Tyler too. That was his slogan. And he died 30 days after taking because he had pneumonia.
Let us know why that is, though, by the way.
Oh, well, sure. No, and who needs to know that now? Of course, that was 160 years ago. But to me, there's a swing in recent scholarship that suggests that William Henry Harrison died of typhoid brought on by a contaminated water supply in the White House. And it's interesting in that, people are still going back into history and looking at, just because we learned that's why this happened and that's how this happened. It's interesting to see that the scholarship is still there and there is still the interest, even if we don't remember what Tippecanoe and Tyler 2 even means anymore. But just, the fact that we're willing to look at the accepted history and question it. And the study with regards to the water supply, they have even stretched that forward to say that this was a problem in Washington for decades. And they think now, too, that Lincoln's son, Willie, I believe, was the one. One of Lincoln's sons that died in the White House was killed by the same reason. You know, Washington, D.C. didn't have a sewer system for decades, and so all of your water was basically runoff. And
have a sewer system now?
And it's always full too, yeah. But the White House water supply was basically ground runoff, and that runoff ran right through what they called a night soil depository, which was a dump for human waste. And so your water went right through a dump for human waste and then into the White House to drink. And so it caused all kinds of problems, including quite possibly the death of a president, possibly a first lady or two, a president's son. And again, these are all things that you discover just by going back and doing research.
It's also true that I said one of the reasons that Garfield was getting on the train was to go to the seaside where his own wife was convalescing because she had developed a fever which was probably related to, I mean, DC is kind of marshy a bit, and so it could have been any number of things that she had contracted. Another point about this historical story that I think is very important but tends to get less attention in some ways is Guiteau himself. So Guiteau, these days, looking backwards retrospectively in history, most people recognize that he probably had mental health issues, that he might have been schizophrenic. He certainly heard voices and other problems. And of course, mental health issues are coming up in this election too, as both candidates, I didn't mean it that way, but as both candidates have been asked repeatedly what's their take on mental health, how do they plan to deal with disabilities. And so again, another public health issue is mental health illness and mental health crises for not having enough centers and not having enough treatment. Do you want to speak to that?
Sure. You know, I think that the dilemma really is that mental health is health, but we've separated them, Descartesian kind of thing. So back to history again, the separation of the mind and body, which has dominated medicine, is better recognized for the relationship between the mind, the psyche, and the body now, but still physicians are very body-centric and much less mind. And when we think of the mind, we think of the neurology of the mind, not the mental health of the mind. It's interesting to note that the root meaning of the word health or heal is whole. So the root meaning of health is to be whole. And it's also interesting to note that while doctors seek cure, that cure can mean removing disease, but it can also mean pickling or hanging meat out to dry. And too often in medicine, we do that. We attend only to the body and not to the mind. And mental health has been the poor stepsister of medicine, which is objective, whereas mental health, you can't categorize it, you can't pin it down to the same degree. It's less scientific. Psychiatry, psychology are somehow less scientific and therefore less valid in the biomedical world.
Public
absolutely.
As well. And there was then too, he did try to get a not guilty plea based on, by reason of insanity. Nobody cared. As a matter of fact, one of the guards who was supposed to be guarding Guiteau tries to shoot him while he's in prison. So he's you know, the president was very well beloved, and he becomes sort of public enemy #1, and he is hanged for his crimes. Did you guys want to make any final comments before we open it up to the group discussion?
Yeah, just to piggyback onto Guiteau, when he was brought to the gallows, and you hit the nail on the head, during his trial, his defense was essentially, the quote was, I should not be convicted for this because the doctors killed him, all I did was shoot him. And when he was brought to the gallows, he danced up the steps to the gallows, and then he was allowed to recite an epic poem that he had written about himself and his assassination of Garfield before he was hung. So he absolutely had mental issues.
That sounds normal.
Sure, that's healthy. Just one more quick thing, the revolver that he used, the weapon that he used for the assassination, when he purchased it, it was a .44 caliber revolver. You can see not the revolver, that revolver was collected by the Smithsonian and then lost, so it's gone now. But on display in the Power and Politics exhibit, we have the same thing. So you can see the type of weapon. It's only about the size of the palm of my hand. When he bought it, he paid $10, and he wanted to spend $11 to get one that had ivory grips, but he didn't have the extra dollar. And his rationale behind it was when he killed the president, one with ivory grips would look better in a museum than one with wood grips, which is what he ended up buying. So again, I mean, it was premeditated. He knew exactly what he was going to do, but that was not, you know, that was really not an excuse. Indeed. And one last thing I wanted to throw out. You had mentioned, you know, he was brought to the seaside to die. If you have been to his house in Mentor, Garfield's house in Mentor, just recently, within about the last, within the last year or so, they collected the bed that was made for Garfield to lie on this trip. So you can go and see the custom-made bed that Garfield died in. It was in a private collection in Maine, but the Park Service recently acquired it, and it's on display at the house now.
Fantastic.
So one brief comment as we move to the next part of our talk tonight as well, and that is I mentioned Robert Wood Johnson and the pathway of Garfield to Band-Aids and Robert Wood Johnson. Well, the Robert Wood Johnson Foundation is one of the largest medical philanthropy groups in the country, and they have rededicated their entire philanthropic approach to building a culture of health in the United States, recognizing that health is not valued in the same way that other values have been integrated into our society, and the belief that if we create a culture of health, it will change everything from mental health to inclusiveness and equity in health. So we can even trace Garfield and his civil rights attitudes towards Robert Wood Johnson Foundation's culture of health today.
Awesome. Thank you. Let's thank our panelists. So what we're going to do now, we're running a little close to our time, so what I'd like to do is give you a moment to get to know your partners in crime here. Turn around, talk to one another. I want you to feel welcome to ask questions, but also to pose questions. So we're going to take about 5 minutes for you to sort of think about questions among yourselves in small groups and have a conversation about that. We're going to be moving one of the cameras while that's going on. And then we'll come back for the main event, the main discussion at the end. So please, meet one another. I'm really excited to hear what you have to say. This is the best part of this event, by the way. I love to hear your thoughts and comments. So who would like to get us started? What did you talk about?
I would like to speak to Dr. Bliss and the fact that, you know, we talk about mental health and his ego, and you were very kind to say that he was protecting the president, but I think, and we had agreement in our group here that he was not just protecting the president, his own ego was driving the other doctors away. They couldn't help him because he needed to be in control. So I just, you know, in the book, and then I just thought that was a valid point to make.
Very, and,
more.
Oh, yes, go ahead.
Do you mind? No, go ahead. Washing hands, doctors washing hands is, I mean, it's just in the past 20 to 30 years that they put signs up in hospitals, and keeping the patients more than 3 feet away from each other in a dormitory setting, it's found to reduce infection, bacterial exchange, but washing hands is so recent, you know, I mean.
Well, that assumes that washing hands really happens in hospitals, and studies looking at that have really demonstrated that still hand washing and antisepsis in hospitals is much less prominent than it should be.
I can just mention, too, that before the 18th century, people thought that dirt kept your pores closed off from infection. They thought dirt was good, and people did not bathe very often. And they actually thought a good smear of dirt was good for you, is what they thought. And I think it's an important thing to bring up the sort of hubris of Dr. Bliss as well. I was trying to be relatively kind. I do think that he had good intentions. But he doesn't let other people in. He doesn't want to take part in this new development. And we might want to say more about that. Anyone else have comments or points about that that you wanted to bring up? Or anything else?
I just had a question about him, and I wondered if Bliss was blamed for Garfield's death in the public's eye, and if so, how did that affect him and his career?
That's a really interesting question. Was Bliss blamed in the public eye, and did it affect his career? Yes, though he got through most of his life, and you can jump in if I miss anything, he got through most of his life without it doing serious detriment. What you don't know, perhaps, is that Bliss, his career had already fallen apart once in his life. He was interested in homeopathy, and he got known for this. The doctors in New York and other places, they were very unkind to him for this. It destroyed his practice, and Garfield was one of the only friends that he had that stood by him in this period. So you can kind of see why when Dr. Boynton, a homeopathic doctor, said, you should wash the wound, he sent him packing, more or less. So yes, his career was ruined kind of before all of this happened, and I think some of his protectionism might be related to that. Did you have anything you wanted to add about?
No, I think you're right on with Dr. Bliss. And I think one of the things that helped Bliss along was that the country had somebody else that they could blame. And I mean, Guiteau was, I mean, rightly so, he was vilified from the very beginning. And it's interesting to think that something is, at the time, was so revolutionary as, oh, you just wash your hands before you stick your finger in the wound, was something that was a revelation at the time. But you're exactly right about Dr. Bliss. His career was already in its kind of tailspin at the time. And again, the country had somebody they could blame. So he missed, at least at the outset, he missed a good portion of the blame because you had Guiteau.
If I can make one other comment, of course, rubber gloves, latex gloves are used in all surgical procedures today. The interesting thing is that they were not invented to protect the body from germs on the hands. They were invented because the antisepsis were so caustic that they were burning the hands of the nurses and surgeons. So they invented the rubber gloves to protect the caregivers from the acids used in the antiseptics, only later to find out that the rubber gloves really were the best way to prevent infection altogether.
Other questions, comments, ideas? Does anybody want to tackle the mental health issue part of this? They're like, no.
Well, was it also with regard to Bliss? What, in the book that we read, Destiny of the Republic, allegedly Bliss suffered kind of a breakdown by the time Garfield died. So he was not capable of taking care of his practice either. So he was in a period of recovery after that for what it was worth, I guess.
Mm-hmm. Yeah. Other thoughts? Anybody want to comment on that? I mean, I think, personally, I think the mental health part of this is, again, it's partly because he becomes sort of public enemy. It's something that doesn't get a lot of traction. You mostly focus on the medical aspects of it or the actual, he just sort of gets villainized. But one of the interesting things that Candace Millard says in her book is that he should never have been allowed to hurt anybody. Like this should have been caught at some point in his life. Does anybody want to comment on that or say other things about Garfield? You guys have been quiet this time. I'm going to give it to you.
Okay. It doesn't have to do with the mental health, but more so, oh, I have to stand up, okay. Here you go. It doesn't have to do with the mental health, but more so when it comes to the antiseptics. So I hear a lot about superbugs being created and antibacterial. So, and we were talking about like the anti-vaccine, people being against anti-vaccine. So is there, I know there's worry now about a superbug being created that we won't be able to fight. So more so, are people leaning more towards not using antibacterial and antiseptic things due to this?
Oh, that's a fascinating question. I want to turn that over to Scott Frank.
I'm going to stand up because I can't see this side of the audience when I'm sitting down. No, is the basic answer. I will say that the issue of superbugs really is generated from antibiotics, not antisepsis. And the increasing complexity of the antibiotics attacking different mechanisms of these infections. We're running out of different ways to attack them. They do adapt and resist, but antisepsis continues to be a herald of what needs to happen in order to keep people healthy. It is interesting that the antibacterial washes, the alcohol, waterless antisepsis, is, I think, just now starting to gain some disfavor, and the point is being made much more consistently that soap and water is the best way to clean your hands, not the waterless, alcohol-based antiseptics. So a shift in that back to good old-fashioned soap and water, but it really is the antibiotics that create the superbugs, not what we do with our hands or bodies.
Other thoughts, other comments? Yes.
This is kind of off topic, but currently the president's health is controlled by really the Surgeon General and the military. So is there any connection with essentially this failure of private practice and the shift to really this private citizen then becoming into the realm of the doctors? I don't know if anybody can answer that. But I think it is.
Are you going to go again? This is why we bring public health people.
So I may have a bit of a different conception of it than you do. I think of the Surgeon General as the country's doctor, not the president's doctor. Surgeon Generals have been enormously important for progress of public health in the United States, from the heavy smoking Joe Califano, who is the Surgeon General who released the 1963 report on the impact of smoking on health, to C. Everett Koop with his highly conservative Republican viewpoint leading the way to treatment of AIDS and HIV. You know, we've had a long history of Surgeon Generals who've gone against what appears to be their personal interest in order to attend to the health priorities of the nation. And Surgeon Generals tend to choose a topic that they're going to focus on as their emphasis. I will say that recently we've had short-serving Surgeon Generals, and it feels as if they've been able to accomplish less in their tenure than some of the historically active Surgeon Generals. Our most recent Surgeon General is very oriented towards the impact of place on health and social determinants of health, on walking as a key way to improve health. You know, physical fitness is hugely important, but walking, physical fitness can be as simple as walking, and people tend to shy away from gyms if they're starting from a place that isn't healthy. But they can always walk, and the walkability of communities has a huge impact on that, and that's the emphasis of our current Surgeon General.
I would say one other thing to that, which is, of course, there was no Secret Service at that time. And so I do think that one thing that did come out of this, speaking of a private person suddenly kind of being enveloped by government authorities, is that the development of the Secret Service, the sense that you shouldn't maybe publish the president's every move and calendar and diary of what he's going to be doing next might be good. Other ideas suddenly that you realized, my goodness, this is a really vital role and people might do unkind things is also something that changed a lot of that. Sorry.
I want to raise one issue about what maybe was going on in that period was a kind of anti-intellectualism. About it abhors me that the medical profession in the United States was so abhorrent to the idea of germ therapy, which was really well known in Europe at the time and accepted. And Bliss and he was not the only doctor at the time that really said, no, that wasn't true. So I find that, and actually I still think there's a thread of that in this country, of anti-intellectualism, this part of our constituency of places all over the United States that doesn't want to really believe in science, in the idea of logic, or things that are, this is true because this is true. And I find that unbelievable. But I have to tell you, I am from Kansas. I'm from west of the Mississippi. And there are places in this country, and this campaign is really reflective of what's happening, is where people live in very rural areas. And the truth is, those people, while they make a living and they may do very well, they are not well educated, nor do they care. That's what bothers me the most, that they don't care. And it's not like those states don't have universities and colleges of learning. It's just that people reject the idea of intellectualism and that information, and that we build our knowledge upon what we have learned before us. And this is what bothers me. There's something very anti-intellectual in this country still here. I'm just wondering if you can speak to that.
Sure.
Brandy and I had conversations about this a lot because
actually, you're not mic'd.
Brandy and I have had conversations about this in part because there's been some really eloquent writing. What is it? The Hillbilly Soliloquy? That might not be exactly right, but it's a good
Hillbilly Elegy.
Okay,
yeah.
Thank you. That is, I've read the book, but I read the review in the New York Times, and it really resonated. My family is Scots-Irish Presbyterian. Just a couple generations ago, they were all hillbillies, but they used education to get off the farm and get out of there back in around 1915. So my family had the luck to go in a good direction, but there's a lot of people still stuck there, and the sense of fatalism and depression is overwhelming. And Brandy could speak to that because she comes from that neck of the woods, and she has a hard time conversing with family members because they see her as part of the intelligentsia.
I can say a few words about that. For instance, where I come from, the people are very downtrodden. And I think it's easy to blame them and say, it's so silly, why do you have this anti-intellectual bent? But in fact, I can tell you from my own personal experience that most of these people feel as though they've been damaged by people with educations, doctors, lawyers, a variety of bankers, for instance. My parents have lost everything several times over, and they've also been victims of a medical system that didn't treat them adequately. My father had a heart attack, massive heart attack, when I was about 12 years old, and his insurance immediately dropped him, which you're not supposed to do. And they thought they had a lawsuit, but my parents are not they have education, but they don't know the wiles. They're not lawyers, and they ended up kind of getting taken for a ride, and they weren't able to make their case. So you can understand that they have a lot of ambivalence at the very best of times, and even hatred and deep distrust of the medical establishment, of the education. The other thing that happens in my community anyway is people get educations and then they never come home again. So there's also a sense of abandonment that comes with that. I do think that comes very much from the heart of this country. We were largely rural until the 19th century. And even President Garfield begins on a small farm that he does not go back to work on. And there's a sense in which I think our country's always going to have this push and pull between the urban and the rural. Other countries did too, but they're a lot further ahead of us. Like they've had these issues long before we ever even got to, as you pointed out, Ohio wasn't a state. When we tend to think that we've always been a state, but of course the United States existed before we were part of it. So it's important, I think, to recognize that education really is key, and outreach is key. Public health starts with the public and with our ability to reach and teach them in, I think, valuable ways.
To come back to the medical side of things, historians of medicine can trace an intellectual heritage of the germ theory back to Oliver Wendell Holmes, Semmelweis, and so forth. Their problem was they couldn't articulate the causal mechanism of what they observed. But also Oliver Wendell Holmes, whose son went on to become Chief Justice of the United States, he made it very clear that he felt that people couldn't accept these ideas when the germ theory finally was coming into play because it imposed upon doctors a measure of culpability that they were unwilling to shoulder. You know, they didn't want to be seen as transmitting germs or being part of the problem themselves, so they were in denial about that. And so within the medical community, that was a very strong issue that was transcendent, I think, for a long time.
Tipping point. Public health can only be accepted if the public agrees that public health is important. And so one of the reasons that you're here today, taking part in these conversations, and I hope you'll come back to see more, is because that's what it's all about. All of us getting together across boundaries, across ethnicities, across cultures, across socioeconomic status to have conversations that matter. And I hope that you'll come upstairs on another day and see the rest of the collection, which is also incredibly educational. And as you'll come back to see our other events, we've got a wonderful lecture on patient rights that's going to be in November, Susan Lederer, and we also have another one of these conversations events in November that will be held at the Museum of Contemporary Art in conjunction with an exhibit on Detroit, and that will also be about public health. It'll be about lead poisoning and industrial damages. So again, thank you all so much for being here. Give yourselves and our panelists and our participants a great round of applause.